I'm being allowed to introduce your guest speaker this afternoon. It's a privilege. My name is Shelley Ryan Gray. I'm your Maternal Child Health Coordinator for Region 7, which is Northwest Louisiana. And my role here for the state, this part of the state, is to look at mortality statistics, mortality cases in our area, fetal, infant, child, and maternal, and abstract those cases and have people like yourselves and others in the community who are interested and engaged in the health of those populations to look at why those children died and those mothers died, and to form preventative measures or enact policies that would be helpful. So what CARE is going to do today is give you a broad overview of those statistics at the state level and at our regional level, and I'm hoping that you might be interested in being part of the review team or the community action team. And my contact information is at the end of your slides, and you are welcome to contact me to get on those lists if you're not already. I want to just tell you a little bit about Cara. She has been a resident of New Orleans for the last 3 years. She came as a CDC fellow, and now we grabbed her as a full-time staff member with the Bureau of Family Health. She had her undergraduate at the University of Illinois, and she is a Chicago person. And her undergrad is in math and chemistry, and she took her Master's of Public Health at Emory in the Rawlings School of Public Health. Just a little bit on the personal side, she's a proud owner of a pit bull mix, and she thinks he's probably missing her right now, so she wants to get home fairly soon to Sailor. And she knew a little bit about New Orleans because her sister has lived here a little bit longer than she has. And I asked her what she loved about the culture of Louisiana as a transplant here, and she was able to say that she felt our culture was quite wonderful, and she liked how nice people were. She tried a little experiment when she went home, and she said, "Hi, how are you?" in the elevator, and got nothing. So, don't we feel good about the state we're in? We might have some grim statistics a little bit here, but we also have some great things about Louisiana. I'm also a transplant to here, and I've been here for 18 years, and I do love being a part of the state. I'm originally from Canada, so if I slip out with an out and about, you'll know why. So Cara, if you could come.
Hi everybody, I'm Cara, like Shelley said. I'm the mortality epidemiologist for the state of Louisiana for the Bureau of Family Health. And so what that means is I provide data statistics for the fetal infant mortality review, the child death review, and the pregnancy associated mortality reviews for the state. So those 3 programs land under me. Shelley is the Maternal and Child Health Coordinator for Region 7. We cut the state into 9 regions, so there's 9 coordinators across the state, and I provide data and statistics to them. Let's see. Okay. So today we'll be talking about Region 7, and as you all know, those are the parishes that encompass Region 7, the northwest part of the state. Real quick, just some background about the Bureau of Family Health. We're on the Long Branch under the Office of Public Health and under the Department of Health and Hospitals. And we are comprised of 2 programs since January 2013. That's Maternal and Child Health Program and the Family Planning Program. So we consist of both of those, so reproductive health and then also all the programs that I mentioned before. I have to say the information on these slides don't include too much about family planning, but if you guys are more interested in that, I can get that information to you. Just a side note about our data, 2013 is actually the most finalized data from the Office of Vital Records, so the birth certificates and the death certificates, but I do talk about 2014 data. It's almost finalized. The numbers aren't going to change too much, but just a little asterisk by that. Also, this presentation is a lot of data. It can be a little dry. If you guys have any questions, you can yell them out to me or wait till the end, whichever one. Okay, so topics I'm going to cover today is I go from infant mortality rate, causes and different things about infant mortality to child mortality, and then end with maternal mortality. At the very end, we have a couple different data sources that we use to look at different risk factors for pregnancy that I'll show you then. So first, infant mortality. So infant mortality in the U.S., Louisiana, and Region 7. This is in 2013. The U.S. infant mortality rate was 5.87. As many of you probably know, 57 countries have lower, according to the CIA's World Factbook. We're one of the highest infant mortality rates in industrialized countries. And then Louisiana is about 8.73. That ranks 48th in the US. We're usually 48th or 49th. Is that okay? Okay. In Region 7 is higher than the state average. It's 9.92 deaths. I ask this every presentation I do. I'll see if anybody gets it. Does anybody know how many births there are in Louisiana a year? Any guesses? The guesses I've gotten are pretty funny, but.
They're pretty funny because you know the answer.
Yeah. It's about 60 to 65,000 births a year. So we're talking about 500 deaths, infant deaths, about. Here's the infant mortality rate across the past 3 years compared to the Louisiana and the US. As you can see, Region 7 is higher than both averages. The US infant mortality rate has been very slowly going down, but like I said, very slowly. And in Louisiana in the past 5 years even, it has been slowly increasing. Here's the infant mortality rate by region. As you can see, Region 7 has one of the highest, second highest to the Baton Rouge area of 10.9. Usually, there's something funky with this year, actually. You can see the Monroe area has a 6.5, which is very low. At the state, we're still looking into this. We're not sure why. This is for 20, I know, that's awful. But to be honest, it was like 10.0 in 2012. It doesn't just decrease like that so dramatically. And then it's 10.0 again in 2014. So the most obvious culprit would be a data error somewhere, but we can't find it. But maybe they did something great that year. Who knows? Okay, here's just another way to look at it, and this shows the black-white disparity. Yeah.
Okay, when you say per region, is that where the baby is born?
No, it's
Or is that by the residence of the mother?
residence of the mother.
So they had a preterm baby in Monroe and they shipped it to Shreveport and the baby died. It'd be a Monroe statistic, not
Yes, ma'am.
not a Shreveport.
Yep. Yep, we do by mother's residence on the birth certificate is how the statistics are cut. Okay, here's again just the regional infant mortality rate, but I do look at the black and white rates here. As you can see, there's a stark disparity in each of the regions and statewide. Oh, I don't have state on here yet, but other race is about only 6% of births in Louisiana. I can report that statewide, but we can't do it on a regional level because of the small numbers. Region 7 has the second highest infant mortality rate in Louisiana, with one of the highest, I think maybe the highest racial disparity, about 3.1. So the black infant mortality rate is about 16.2, and the white is 5.2. Here's just another way to look at it throughout the regions. I do this presentation for the regional coordinators, and they like to see how they're compared to the different regions all the time and how they've been going through the past 3 years. I just gave this presentation in Region 5, and you can see that one, it's been increasing dramatically recently. Here's a deeper look at Region 7 infant mortality rate. The rates are on the right with the number of deaths per year. So as you can see, in 2011, there were 92 deaths. 2012, down to 72, and 2013 at 76. So it has been overall decreasing, but it is still above the US and Louisiana average. Okay, this is what I just spoke about a little earlier. Here's the disparity in race for infant mortality rate. These are the rates with the number of deaths next to each year. In most recent year, 2013, the racial disparity was a little bit over 3, and there was 56 black infant deaths compared to only 19 white infant deaths. Someone noted earlier when I presented, there is a dramatic drop from 32 to 19 from 2011 to 2012. We're looking into that a little more. We're not sure. With such small numbers, they do tend to fluctuate like that. I'm going to look back further than 2011 to see if it was above that before. Okay, preterm birth, this is one typo. That should be less than 37 weeks gestation. I apologize about that. Yeah, it's not. Someone pointed that out earlier. And as you can see, this has been staying pretty steady the past 3 years. There is the disparity in the black and white population. And Region 7 overall, especially, it's interesting, the white population in Region 7 is above the Louisiana average. And again, with low birth weight, less than 2,500 grams, there's the black-white disparity. Overall, Region 7 is above the Louisiana average. Okay, so here's some causes of infant mortality. To be honest, I'm not medically trained, so you guys probably know a lot more about these parts than I do. But 45% of our deaths are conditions originating in the perinatal period, and then 18%, or about a fifth of the deaths, are due to congenital malformations, deformation, and chromosomal anomalies, the birth defects. And then 16% of the deaths are sudden, unexpected infant death. At the Bureau of Family Health, we look a lot at the SUID cases because they're some of the most preventable deaths from a public health standpoint. And here's the Region 7, specifically causes of infant mortality. You can see there's a bigger chunk due to the conditions originating in the perinatal period, and then a little less SUID percentage compared to the state overall. And this is from data 2013 to 2014, and there was 127 deaths total during that time. Okay, like I said, at the Bureau of Family Health, we do a lot of work around SUID. It's about a third of my work. And these are the rates from 2010 to 2012. And how we define sudden unexpected infant deaths, it includes 3 causes of death on a death certificate. It includes SIDS, which is the common, everybody still uses that word, which is fine. Unknown cause, and then accidental suffocation and strangulation in bed. And in the Shreveport region, from 2010 to 2012, there were 39 cases due to SUID, and that rate is the second highest rate in the state. With an overall Louisiana rate of 1.2, it's higher than that. So here are the SUID rates by region. The Lake Charles area consistently has the highest rate of SUID. There's a lot of different prevention activities around that in that area. But the Baton Rouge area has been increasing recently. Okay, neonatal abstinence syndrome. I just added this in there because I get a lot of questions about it. To be honest, there's somebody back at the office that does a little more work with this, but I'll try to cover it as best as I can. I'm sure many of you know what NAS is. It's when a prenatal drug exposure produces different problems, such as neonatal abstinence syndrome. It's a treatable condition that newborns experience after chronic in utero exposure to substances, and different symptoms may occur. These statistics are actually just from the Medicaid population. These are the best statistics we have so far. We're trying to get the full population, but each year about 70 to 75% of our births are Medicaid, covered by Medicaid, so it is a vast majority of the births. So from 2003 to 2013, 4,143, or 0.9% of infants were born exposed to drugs prenatally.
Which drugs mean? Is that any medication?
It's opioids, I believe.
Okay.
Correct, yes. And then 51% of those 4,000 were diagnosed with NAS. So about 50% exposed actually have the symptoms to be diagnosed. And the NAS rates have increased dramatically since 2003, as you'll see on the next slide. So this is the NAS trend from 2003 to 2013 in the Medicaid population. The dashed line, the dashed line is the rate of exposure, where the solid line is the rate of diagnosis. It has been increasing dramatically Parts of it may be due to more diagnoses of this, but there is still an increasing problem. And here's NAS by Louisiana Parish. This again is still just the Medicaid population. And this is just the number of infants diagnosed with it. It's not the rate. I'm going to try to redo this slide with the rate in upcoming weeks.
Is this mother's residence or
Mother's residence. Almost always it's mother's residence. Oh, can't really think of if it's when it would be otherwise. So as you can see, the northwest region of the state does have some of the highest counts of NAS within the state. Okay, this is just a quick couple slides. I wasn't sure where to put this, but I get a lot of questions about teen pregnancy and teen birth. This is teen births in Louisiana since 2007, and as you can see, they've been decreasing. This is a national trend across the U.S., but there still is the black-white disparity, you can see. And this is also for teenagers 15 to 19 years old. I usually cut it off from 15 to 19. I know there are births to 11 to 14-year-olds. If you add them in there, as you probably know, that it makes the teen birth rate actually look a lot lower than it is because you have to put the population in there. So here's teen births in Region 7. It's also been decreasing like the state and the U.S. There still is the racial disparity, but you can also see just the number of teen births in Region 7 has been going down just quite a lot, just the pure number on the bottom, from 982 in 2011 to 645 in 2014. Okay, these are just a couple things that the Bureau of Family Health is working on in the Louisiana State Health Department overall. The CDC SUID grant, we investigate all SUID deaths, our coordinators do, and then there's a review of them. The Safe Sleep Initiative, it's in 100% of the birthing hospitals. And then our Partners for Healthy Babies canvassing campaign includes breastfeeding techniques, no smoking, things like that to address risk factors. Okay, so moving on to child mortality. Excuse me. This is child mortality by region. And Region 7 has about 26.7. That's a little higher than the state average at 25, and then higher than the U.S. average at 19. Again, the Monroe region has one of the highest child mortality, and I presented to them, and one of the most interesting things about that region is deaths due to guns. As you'll see, car crashes is the #1 cause of injury death, but in the Monroe region, deaths due to guns is almost outpacing car crashes. Here's the child mortality in Louisiana. This is, as you can see on the bottom, I combine years because it is still such small numbers, and it does fluctuate a lot because of those numbers. If for some reason I know there was a case in Region 9 where 4 kids died in a car crash, if something like that happens in your region, your child mortality rate can look incredibly different than from one year to the next. Okay, and here's the causes of child death in Louisiana. So this is on the state level. About 35% of child deaths, this is ages 1 to 14 years old, are due to injury. That's the #1 cause of death. And then of those, that's what makes up injury. Motor vehicle crash is about 34%. Homicide and drowning are 21% each. Then fire, suicide, traumatic brain injury. Traumatic brain injury is by itself. It's not caused by either one of those causes. And then accidental firearm. And here's just the trend in Louisiana injury deaths since 2006. Motor vehicle accidents has been decreasing a lot, hopefully due to different prevention campaigns and work with car seats and whatnot. Homicide and drowning have been going back and forth, competing for the second cause of death, and then the last 4 on the bottom there. And here's child death in Region 7. As you can see, injury is about 50% in Region 7 compared to only 35% in Louisiana, so it's a bigger proportion in this region. Motor vehicle accidents is about 50% almost, and then drowning, homicide. And then there were a decent amount of suicides actually, which we've been looking at more and more because they're getting younger and younger. Yes, so this is 1 to 14. And these are still very small numbers, but the numbers have been increasing. I just started looking at 15 to 17-year-olds actually, just to see the number of suicides, and those have been increasing a lot in the past decade. So injury was the leading cause of death among children 1 to 14 years old in Louisiana and Region 7. 115 child deaths over those 4 years, 2011 to 2014. 56 were due to injury, 26 motor vehicle accidents, 12 drowning, and 10 homicide.
The homicides, do you have the numbers on how many of those are accidental homicides and how many of those are intentional?
I don't. I'm just trying to think how it's worded because we do have accidental firearm. I think it's up to the discretion of the coroner because I'm just taking it off the death certificate. So there's a box that is checked homicide, and that's where I pull it from.
Cara,
Yeah.
some of those are vehicular homicides. So those would be less perhaps intentional than when a baby is shaken baby, or babies are purposefully intentional.
So it could be like a drunken driver or something like that?
Yes. And sometimes it's apparent, depends on the situation. Hospitalization is unrestrained, or there's been other things.
Yeah.
We reviewed a few lately that have been vehicular homicides.
Okay, and then these are just a few things that we're doing at the state. We have regional child death review meetings, and then there's a governor mandated legislatively panel for child death review at the state level that meets in Baton Rouge. And these are some recommendations that have come from it. We're actually just getting some legislation through, hopefully, maybe not this time around, but boundaries for pools and whatnot. We're not to the national standards for those types of things.
Can I mention something real quick?
Yep.
You may be aware of this, but in Region 7, which is all of those parishes that we have, there are only 3 places you can go to have your car seat checked, and they're all in the Shreveport Bossier area. So parents that live outside of our metro area have a challenging time to go to a certified car seat technician and get them checked. And those are Safety Town, Bossier EMS, and Church.
I was under the impression you could get them at any fire station.
Not anymore. The certification is very difficult to obtain and retain, and so many of them have let that go. It's not that they're not knowledgeable, but they're not under the protection anymore of the state in terms of if they said A or nay. So those are the 3 locations, which for us living here, it's great. If you don't live here, it's more difficult. So if you're working with prenatal patients, the time to get their car seat checked is before the baby arrives, especially if they're already here to see you for care and they live outside of the area.
Okay, lastly, we're going to talk about maternal mortality. Maternal mortality, we actually reviewed it before Katrina up until 2005, and then it kind of went on a hiatus until last year. So we're just renewing that at the state level to look at these deaths. This is kind of a wordy slide, but there's 2 big definitions of maternal mortality. Pregnancy-associated maternal mortality is what we look at the state level. That's a death to any woman during pregnancy or within a year of pregnancy. So this is a woman who dies of a pulmonary embolism 2 hours after giving birth, or a woman that dies in a car accident 4 months after giving birth. So we look at all of those. In the United States, there's no official number from the CDC or the NIH. There's a couple papers out there that give estimates, but they don't collect this information officially. And in Louisiana, it's about 67 per 100,000 live births. And then there's the more, this is more standard across the U.S., the pregnancy-related maternal mortality ratio. This is a death to a woman directly related to that pregnancy. That's about 12.1 in the U.S. That's a lot higher than many other industrialized countries. And in Louisiana, it's about 17.9, and we're 44th in the US. Excuse me. So this equates to about 60 to 70 deaths per year. About 25 of those are medically related. One of the big reasons we do look at associated deaths and not just the medically related deaths is domestic violence is the #2 cause of death after pregnancy. It actually increases your risk of domestic violence being pregnant in Louisiana. So we had about 20 deaths. I think, yeah, after 25 medically related, there were about 20 domestic violence deaths within a year of pregnancy. And these are too small numbers to report by region, so all the following slides are just statewide. Again, there are the disparities in maternal mortality. Overall in Louisiana, it's about 78.7 Black deaths per 100,000 births, and only 58.9 white deaths. In medical, you see the same disparity, and then also death due to gun violence as well. It's almost fourfold. So what we've been working on is we do these mortality review meetings to learn the causes and any prevention techniques. Trying to create a report because sadly our most recent report is 2001 to 2005. And then the Every Mother Initiative was an Association of Maternal and Child Health Programs grant that helped us create a domestic violence screening workshop in the medical setting. And then we use a new data system from the CDC that's going to help us standardize across states. The CDC uses a checkbox off the death certificate. We have a checkbox that asks if the woman was pregnant within 42 days, 43 days to a year, or not pregnant at all. A lot of times that checkbox is not checked if the woman was pregnant, if she died within 43 days to a year of her pregnancy, because a lot of times you don't know. So we're looking at how to improve that. Okay, lastly, some extra data sources. These are the data sources that I use for this presentation, mainly our different death review data systems and vital records. But lastly, we have the Pregnancy Risk Assessment Monitoring System. This is a survey that goes out to about 2,500 Louisiana women each year, 3 to 5 months after giving birth. And it's a pretty lengthy survey that asks about a lot of different risk factors. It's a surveillance project of the CDC. About 44 state health departments use it. It collects different population-based data, mother's attitudes and experience before, during, and shortly after pregnancy. And again, you can only report this statewide.
How many do y'all send out?
I'm sorry, what?
What amount do y'all send out?
About 2,500.
What response rate do you get?
We get about 65%. 65% is the cutoff for CDC that they allow, and we actually just got back up to that since Katrina. We were in the high 50s for a while. And we do, there's a weighting scheme, and we do focus more on low birth weight and preterm moms. Okay, so for tobacco use, in the last 3 months of pregnancy, about 17.6% of white women smoked or reported smoking, about 10% of black women, and 8.2% of other women. Overall, 13% in the last 3 months, and 30% in the last year, but only 5% allowed smoking in their homes. This is one of the big things we get from this survey, because even though smoking's on the birth certificate, it's highly underreported. I think it says 2% if you look at that. Here's just a little bit about breastfeeding that we get. In 2013, 3 out of 5 Louisiana moms reported that they had ever tried breastfeeding. And then here are some of the top reasons why mothers reported not breastfeeding. There are little generic answers we're working on with the CDC to fine-tune that a little more. 46% just did not want to, 27% did not like it. And overall, 73% of white mothers reported ever breastfeeding, compared to only 51% of black mothers. Okay, just some quick ending PRAMS findings. Pregnancy intent, 61% of Louisiana women were not trying to get pregnant when they got pregnant. That's about the US standard, it's about 50 to 55%. Of those, I have to say, of those 61% of women, 50% of them didn't mind getting pregnant. So, just to put that out there. Stress, over 80% of women experience at least one major stressful event during pregnancy compared to 70% in the US. The stressful events that we ask about include from partner violence and different issues around the partner, traumatic life events such as loss of a loved one, financial crises such as losing a job, and then other things such as moving during pregnancy was the most reported stressful event, being homeless during pregnancy, such as those. Guns, 9% reported having a loaded gun, rifle, or other firearm in their home. And then safety, about 30% of women reported ever feeling unsafe in the neighborhood where they lived. And I actually just did a quick study looking at those two intertwined, and they were actually not correlated in Louisiana. I think that's it. Thank you. Any questions? Oh.
Notice in one of your slides on infant mortality, 8% of death is due to injuries. Can you elaborate on the type of injury for an infant and how they get the injuries?
I honestly have not looked into the infant injury too much, besides SUID, if you consider it an injury. Shelley, do you know anything more? Have you reviewed any injury besides shaken baby, maybe?
Drowning.
Oh, drowning would be one.
Drowning of an infant, and then homicide.
Yeah.
Yeah, and motor vehicle accidents. We've had children who died of the major causes you've seen there. I haven't had a death by firearm of an infant at this point, but other injuries.
I haven't seen a trend of any big one type of injury causing that piece of the pie. That makes sense.
Is there a disparity, a racial disparity in SUID deaths?
Yes. Yeah, there is. It's such small numbers, but if I combine a lot of years, I can look at it. But there are, it is a racial disparity. It somewhat goes along economic lines a lot of times, but and it also depends regionally. I know in Region 7 there is the disparity. Anybody else?